Hi, my name is Richard Jaguar, and I'd like to welcome everybody to my presentation today on Troutman's Jordan's theory of successful aging. In presenting on this topic today, I'm hoping to provide some clarity and understanding on this theory because Troutman Jordan's theory provides nursing with an understanding of how aging adults can successfully navigate through the challenges of aging and continue to have purpose and meaning through the later portions of their lives. It also provides pathways to interventions for nursing to assist patients if they are struggling to achieve them. So Dr. Meredith Troutman Jordan graduated from Presbyterian Hospital School of Nursing, where she had earned her associate's degree. She went on to get her BSN from Queen College, and then went on for her MSN in psychiatric mental health nursing from the University of North Carolina. She continued on from there to get her doctoral degree in nursing science from the University of South Carolina, and she was also a certified psychiatric mental health clinical nurse specialist. Through that work, she had worked in with older adults in home care, and had found some interest in that. And while doing her doctoral work, formulated this theory on successful aging. She continues to work on that theory. There are other research projects that she's been involved with that continues to refine the theory and get it to where it is today. So as Dr. Troutman was formulating her theory, she used the framework laid out by Walker and Avance called the concept analysis. It's an 8-step process that focuses the idea that the theorist has. The 8 steps involved in this process are: 1, selection of concept for analysis; 2, aim and objective of analysis; 3, identifying the use of the concept; 4, determining the defining attribute; 5, constructing a model case; 6, constructing additional cases; 7, identifying the ascendants and consequences of the concept; and 8, defining the empirical reference for the concept. And then through this process, this 8-step process, it allows theorists to scientifically analyze their concept and then create a statement. And in this case, the statement was that an individual's perception of favorable outcomes in adapting to the cumulative psychological and functional alterations associated with the passage of time while experiencing spiritual connectedness and a sense of meaning and purpose in life. So that statement there sort of is at the root of this theory of successful aging. She also referenced Roy's adaptation model and the 3 levels of that adaptation: the integrated, compensatory, and compromise. And when she would view aging through those different levels of adaptation, she saw integrated as someone who was successfully moving through the stages of aging and those changes that come along with that. And then compensatory would be someone who is in that process as well, but is dealing with some more difficult challenges associated with some illnesses, but still able to use their coping skills to move through those challenges. And then compromise would be someone who, in the states of illness, are not able to successfully cope with those changes and get themselves into a situation where they become hopeless and really kind of pull back from society. So when considering the meta paradigm related to the theory of successful aging person, we're thinking about the the population, the aging adults greater than 60, being the focus of this theory. Health, we're talking about the age-related conditions, chronic conditions that develop as people get older, and those effects on the person. Environment, we're talking about their place of residence, really, because people could be at home, people could end up having to live in assisted living situations, or in skilled nursing facilities. And then nursing, now we're talking about the interventions that nurses are going to do in order to promote successful aging. When we're considering the things and the issues and the success that a person might be having as they're going through these challenges, nurses could be there to help support and encourage and educate in order to get people to move through those stages if they're having difficulties. So as Dr. Troutman was considering the process of aging and her thinking about the theory, she came up with these three coping processes that she considered the foundation to her theory. They are the functional performance mechanism, the intrapsychic factors, and spirituality. So when Dr. Troutman was considering these three coping mechanisms, the things that she was thinking about first with the functional performance mechanism was dealing with functional loss. So as someone is getting older, their mentation may be declining, their mobility might be declining. There's all these things that happen as we get older that are inevitable in some cases, in all cases really, just to what degree. So in this piece of the coping mechanisms, we're looking at health promotion activities. That's going to see your doctor, following up on annual exams, making sure you're eating right, physical health. There we're talking about if you have some history of illness, if you had diabetes or some other chronic condition, how you've been dealing with that as you get older, through your life and as you get older. And then physical mobility. Do you have arthritis? Do you have some other issues that's creating some limitations in how you're getting around? The next one is the intrapsychic factors. And so when we're thinking about that, we're talking about innate lifelong coping skills. These are things that you've done throughout your life that's helped you deal with things as you've gone through them. And the three things that Dr. Troutman was looking at here was one, creativity. That's how is it that you're able to kind of think outside the box when you're faced with a problem and getting around those problems. Positive and negative effects. Really here, we're talking more about the negative effects and the degree of the negative effect. Dr. Troutman kind of pretty much said my concept or understanding of this was no pain, no gain. So really here, if you're going through something and it's causing you some discomfort, not just physically, but maybe emotionally, in a lot of cases, this could be an impetus to kind of get things moving in a different direction. And so when she's talking about a negative effect, she's talking about kind of a low level negative effect that can be that kind of motivator. But unfortunately, if that negative effects kind of compounds and things aren't moving in a positive direction, they can turn into inhibitors in terms of keeping people from actually moving forward and learning to cope with these aging processes. And then personal control. Obviously, if you're having a hard time kind of keeping control over things in your own personal life, if you're feeling victimized all the time, you're not going to be able to make those changes in order to overcome some of these changes. And then finally, it was spirituality. In this case here, she was making a point that if you are able to be connected and have a belief that there is something greater than you, then that belief can help kind of overcome some of these changes. And then this brings us to the next concept in this theory, which is the concept of gerotranscendence. So in this case here, we're talking about kind of moving forward in the process after dealing with those three concepts of coping, that we would get to this next level where there is a sense of moving forward and connectedness with something greater than ourselves. So there are three different levels in this concept. There's the concept cosmic dimension, which is where we sort of understand that we're a part of something bigger than just ourselves. And that she termed it a connectedness to the universe. The next is the self dimension, where we have an acceptance of ourselves and where we are in the process of aging. And then there's the social dimension, where hopefully as we age, we understand that we can't just do it all on our own and that we need to be a part of society. One of the things that I found interesting was that in that process of becoming a part or connected into society, as we get older, we become more selective in terms of who it is that we're going to be connected to. So it's not just being a part of all of society, but sort of having an understanding that there are certain parts of that society that will help us move through these levels of acceptance. This model here I took from the book, which really shows the way that these areas are connected. So you can see how there are the three levels of coping: the functional performance mechanisms, the intra-psychic factors, and then the spirituality that kind of work together. And as we move through those parts and that are connected there, we are able to move up through into that level of geotranscendence, and then up and have successful aging, and in which case we are finding meaning and purpose in our life. So when looking for studies where this theory has been used as the basis, I found two different articles. One was called The Successful Aging Among Assisted Living Community Older Adults. In this case, Dr. Meredith Troutman collaborated with Mary Alice Kozar and Dr. Mary Nice in looking at adults who lived in assisted living communities, and used several tools to assess whether they were successfully aging. And one of those tools was the Successful Aging Inventory tool. They assessed 200 participants that were greater than 65 years of age, and in their assessments they were looking at cognition, depression, medical conditions, demographics, their overall health, chronic health conditions, whether they exercised through the use of these tools. And what they did find was that the adults that lived in these communities were showing that they could have successful aging process. And that one of the things that they also found was that women seemed to score higher in their assessments. Another study that I looked at was also done by Dr. Meredith Troutman in association with another nurse, Julie Staples, in which case they did a qualitative analysis of two previous studies that had been done, where the main question was, what does successful aging mean to you? And so they looked at 311 participants. Predominantly in that study, it was mostly white women. And through that study, they were trying to validate the theory that the theory of successful aging that Dr. Troutman had put together. And so through doing that, they found that there were some core issues that were being brought forward that these people felt was intricate in their successful aging. And the biggest one was that people felt that you needed to have positive perspective and positive coping skills and this just keep going attitude. Um, the one thing that in both studies was clear was the aspect of spirituality seemed to be lacking in both of the studies. In one case, the first study, they didn't really even talk about it that much. And then the second study, they referenced that only 22 of the participants of the 311 referenced spirituality as being a major influence in their successful. So when reviewing this theory and some of the pros and cons, what I came up with as far as strengths was that it definitely comes at aging with a holistic approach. It's looking at the whole person and all of those components that might help them succeed in getting to a successful aging process. It's also very patient-centered in terms of looking at individuals and their coping skills, and then focusing interventions based on those either successes or not so successful processes. When I looked at weaknesses, I found that focusing on the spirituality, I mean, for myself, I can understand where that comes from and how that would work. But in some cases, that might not be something that can easily be connected to this process. And I think that in those two studies, it sort of became apparent that that might be a little bit of an issue in working through this theory. And then also when I'm talking about limited participation, so through all of this process, it's really through the nurse developing rapport and relationship with the patient, and the patient kind of opening up and letting us know where they're coming from. And if we're not getting the participation or the honest answers, it's really going to hinder our efforts in producing successful. In my case studies, I'd like to speak about two different individuals. The first one is Mrs. O'Brien. She'd come into our facility, an 89-year-old woman who had just had serious open heart surgery. Typically, we didn't see patients come in this old having had this type of surgery. But in this case, Mrs. O'Brien had been able to show her surgeon that she was a good candidate. And that was through demonstrating the successful aging process. She had been successful in health promotion activities through the years. She had also had good overall physical health, and she was also able to be physically active, which were all good parts of the functional performance mechanisms that Dr. Troutman talks about and part of those coping skills. She also had the intrapsychic factors where she was able to use her negative effects in this situation and use those to her advantage to move herself forward in her rehabilitation from this procedure. And she also had the spiritual piece where she had solid connectedness to a power greater than herself that she spoke about and used as a way to move on into that geotranscendence where she had purpose in moving forward and having the successful aging process. Unfortunately, the other person here is Mr. Smith. He had come in after having a bout of CHF and COPD. He had definitely on paper looked like he was going to be a good candidate for discharging home. We were able to get him medically stable, and he worked through rehab. But every time we got close to discharge, barriers would come up, and these were self-imposed barriers that he didn't even see. And unfortunately, the negative effects took hold and brought him into depression, and he ended up becoming a long-term care resident with us who ended up passing away at our facility. He did not have to be that person. but unfortunately, he was, even with all the nursing interventions, was not able to have that successful aging. Here are my references that I use for this project, and I'd like to thank everybody for taking the time to listen, and I hope you got something out of this. Thanks.